It is one of the hottest weeks of the year, and when wearing a mask, it feels even hotter out there. So in today's To Your Well-Being, we are talking about how to stay cool in the summer heat during COVID-19. Cone Health's Chief Physician Executive, Dr. Bruce Swords, joining us. And so we want to talk about this. How are some masks cooler than others, or are there masks that are cooler than others?
I'm sure there are some masks that feel more comfortable than others. I'm with everybody else. Wearing a mask outside when it's 85 degrees and warmer outside is really uncomfortable. The breath is hot. It's hot outside. It's humid outside. Your breath is humid. It's uncomfortable, and it's still the right thing to do.
So do you have any tricks, recommendations on how to stay cool while outside and, social distancing and wearing your mask?
Yeah, this past week, I think it's almost impossible to stay cool outside in the heat of the day. I'd be telling you this last year or the year before is go out early, wake up early, go out early. It is nice and cool and somewhat refreshing early in the morning. But that's the time of day to go outside. If you're trying to stay cool outside at noon, you're not going to do that with or without a mask on.
And so you kind of alluded to that if it was this time last year, around the same time, you'd probably be talking about heat-related illnesses. So kind of let's tackle that now, some signs of heat-related illnesses so that it will be top of mind for us.
Yeah, good question for any summer. And the key to staying as cool as you can is to make sure you're hydrated. So drink plenty of water, whether you're inside or outside. Water has an evaporative, you can evaporate the water from your skin. It has some cooling effect. And it's important to stay hydrated because when you are outside, you are going to lose a lot of water quickly, and maintaining hydration while you're outside is important, and being hydrated before you go outside is important.
I think when someone's having a heart attack or a stroke, calling 911 is the first thing that's on your agenda and on your mind. But what do you do when people are experiencing heat-related illnesses, also which can be deadly?
They sure can be. And so some symptoms of heat-related illness, one is you're hot. Other signs and symptoms are really stopping sweating. So maybe it feels like you're getting better, but if you quit perspiring outside when it's this hot and humid, that's frequently a problem. Being exhausted, overly tired with minimal exertion is a concern. So all of those are symptoms that would suggest you need to get inside and get in quickly. When people get to the point where they really are having a measurable fever from being outside, 101 or higher, they can't cool off, they pass out, they lose consciousness. Those are reasons to seek medical attention very quickly because heat-related illnesses can be deadly.
Mm-hmm. So many people have been asking, can the high temperatures slow the spread of COVID-19?
Well, we don't know. And I think the evidence would suggest that that's not the case, at least in our country. It's hot, it's humid. We have more cases in our country. We have more cases in many states, including North Carolina. And it's not just the cases. Cases you might be able to explain away by, well, we're testing more. That's true. Probably explains some of the increased cases. But we have more hospitalizations, and the entire state of North Carolina continues to have more and more hospitalizations.
All right, so on that whole thought there, so the whole, hey, it's going to be summer and the flu's going to go away is not happening. We are not seeing that. So people are waiting in the car for things like medical appointments. They're waiting in the car for things like testing sites so they can get their test. Is there something that they can do or take with them to help stay cool and stave off those heat-related illnesses?
Yeah, I think you need to be really concerned about sitting in a car for any period of time. If you are waiting outside of any place of business or outside of a physician's office or the hospital waiting on a loved one, you need to make sure that you can go to a place that's cool. Get outside, go under a tree, sit in the shade, park in a parking deck. It would not be advisable to sit in a car in the sun for anybody. So don't do that. Do anything other than that. And again, after you take care of that immediate need, staying hydrated is important. Drink water. Cool water might feel more refreshing. It probably isn't all that critical what the temperature of the water is. Just make sure you're hydrated.
A lot of times, people want to maybe run into a store quickly. They're the ones wearing the masks. Some of the kids may be inside the car and they're thinking to themselves, I'm just going to leave them there for just the few minutes that I need to go into the car. And I can already see you shaking your head.
Yeah, nothing's important enough to leave your kids in the car. I don't care what's in the store. Either take the kids with you, make sure they're masked up, or take the kids home and go back to the store. Do not leave your kids or pets in a car for any length of time, especially this time of year. Just don't do it.